Welcome back to Great Day Medical Monday. Our next guest started gaining weight in her 20s. She tried dieting and exercise, but when she was still struggling to keep up with her daughter, she decided enough was enough. Today, Amy Pruitt is at least 95 pounds lighter thanks to Dr. Brian Mirza and Bariatric Care Centers. All right, welcome back.
Thank you.
Okay, so life was kind of normal for you, and then in your 20s, started gaining weight. When was it that you said, wait a minute, this is not just a couple of pounds here, something's going on here?
Over the years, it just progressively got worse and worse. And then as I'm with my daughter playing softball, I'm like, I can't run, I can't do this, I need to change something.
Yeah, you were doing the dieting and exercising, and what was happening?
Every time I would lose, then within just a few weeks, months, it would immediately come back.
Yeah.
No matter what I did and kept with it, it would still just continue to come back every time.
Dr. Mirza, you know, oftentimes we look at this as an aesthetic issue, but if she was gaining that kind of weight in her 20s, chances are this was really going to be a tough problem for her and possibly threaten her life at one point.
That is completely true. So weight is not only a cosmetic issue, it is a major health issue. It actually is one of the most prominent cause of death in the United States and elsewhere in the world.
Yeah, type 2 diabetes, cardiac issues, all those things.
Heart problems, high blood pressures, sleep apneas, arthritis, aches and pain. Actually, every function of our body suffers the consequences of our excess weight. Essentially, how I explain it to my patient is, you're just putting so much excess of work on your body functions. So all of those body functions are working significantly over time, so they get tired so quicker.
Yeah.
So your quality of life and your longevity is significantly affected.
There are different types of bariatric surgeries, if you will. Why is the sleeve something that you like?
So actually the sleeve is the #1 weight loss surgery in the US nowadays. It's been around now for 10, 15 years. It's shown significantly to be very safe. Actually safer than many other alternatives that were used in the past, very effective, and also it showed again and again when compared to other surgeries to be a overall good bariatric surgery. Actually, this is the surgery I recommend to my own family members.
Yeah, and in fact, a lot of people who may be dealing with high blood pressure, type 2 diabetes, all that type of stuff, when they've gotten the sleeve, will come out of surgery and those things are gone.
So very, very often, so rates of resolution or improvement of major health condition that we just mentioned are as high as 90% or more. And I see so many of my patients usually in a matter of few weeks. They're off 10 and 15 different medications.
Yeah.
For diabetes, for high blood pressures, for so many other aches in the joint, for all the medications. Those medications are chemical still, if you can get off them and be healthy.
Yeah, because those medications don't really solve the problem. They can help you maintain some things, but they're not solving the actual problem, and this can actually solve the problem. Okay, so you have the surgery done, and then you wait, and then the weight starts coming off. You became a whole new person, didn't you? Because before, 95 pounds, in fact, that is like, Alexis is one of our producers here, okay? So that is like carrying Alexis around all day long, right? 24/7. When you're sleeping, Alexis is there. When you're at work, Alexis is there. You're running around with your daughter, Alexis is there, right? Go back to work, okay? So this an example, you lost almost the size of a whole nother person.
Exactly.
When somebody's thinking about doing this, it is a process. And so your best advice to them, to pull the trigger and go ahead and get it done, because I have a couple of friends who are putting it off, and I think they're afraid of the person they're going to become, right? But for you, what changes you had, how to keep up with those changes, and just kind of this unveiling of a whole new you, healthy you.
So it's definitely a process. When you're selecting a surgeon, definitely do extensive research. I'm a nurse, so of course I did my extensive research, and Dr. Mirza by far is amazing. I can't thank him enough. So definitely look at your options and what you want to change about you, and don't take the decision lightly. It is a full entire life change, but it's amazing if you do make the choice.
When we say full entire life change, the thing is that the surgery aids you to do what we should all do really in our eating process, right? So you have to still concentrate on a healthy diet.
Do your part. So essentially it is a tool, a very effective tool, but you're still in the actually driving seat. You are in charge of that tool to make sure that that tool works well, to maintain it, to make sure that you change your lifestyle, as you're losing the weight, as you're monitored very closely, and we are a comprehensive center where we provide all of the services to make sure that your nutrition stays up where it needs to be. Your activity increases actually. As you're losing weight, it's easier for you to be active.
Yeah.
You
I
can
love
ask
that you made that
somebody
point,
who's-
that bariatric care centers, because it's not just the surgery and out the door and good luck. That you can
That's
continue
the major.
to call if you start to find yourself slipping at all. You can call, or if you're having any issues, you can call, right?
Absolutely. He gives you his number, and 24 hours a day you have access to any kind of care that you need.
Okay.
So you're definitely well taken care of.
Let me wrap up with the person who qualifies for bariatric surgery.
So weight loss surgery is not for everybody. You need to have significant health conditions that we can resolve with the surgery. So we look at something called the body mass index, which is a calculation of a person's height and weight together. And that body mass index usually needs to be above 35 with health condition, or above 40. Those are actually the recommendation by National Institute of Health.
Right.
So we follow all of those criteria and recommendations. And as I mentioned earlier, we are comprehensive in our care.
Yeah.
We really believe in improving the safety and success of the surgeries by doing extra work before and significant follow-up after the surgery. It's not only about the surgery, it's about all of that comprehensive care.
Yeah, Dr. Mirza, thank you very much, and I'm glad you got rid of Alexis. Although we love her, Okay, Bariatric Care Centers has a special offer for Great Day viewers. The first 20 callers will get a $500 discount, but you have to mention Great Day Houston. To schedule a free one-on-one visit with Dr. Mirza, call this number right there on your screen at 713-339-1353. 713-339-1353. At least get that consultation so you know where you stand and you can make some decisions. You can also learn more at drbrianmirza.com.